First, I want to tell you that 95% of the time I'm able to reduce and eliminate the pain and inflammation of plantar fasciitis using conservative treatment. I've found that if I don't get a patient's inflammation down, whatever else I do to heal their plantar fasciitis won't work. Inflammation is what drives the pain, so that's the first step I take. Some of the things I'll recommend you could do at home, but I'll start with what happens in the office. After evaluating your condition, I'll better understand the extent of your inflammation. If you've been suffering for a long time and I see a lot of inflammation on ultrasound, I may first suggest a cortisone shot to get the inflammation down quickly. We also have non-invasive MLS laser therapy, which can work well for people with acute pain or if they've had the condition for quite a long time. The laser therapy helps not only reduce inflammation, but heal the tissue. For many of my patients, I'll start by supporting the foot with taping and an air heel. Both of these modalities are very effective at taking pressure off the heel. Occasionally, I'll recommend a walking boot if your pain is so intense and if you can't get relief with the other medical devices. I'll likely also recommend you start on an anti-inflammatory medication by mouth if you aren't already taking one, as long as your doctor approves their use. Some things you can do at home to help relieve your inflammation and pain are icing, massage, use of topical creams, and self-taping. Icing is one of the most important things you can do to reduce inflammation and pain. You can even begin doing this before you come to see me. There are two methods you can use to ice your heel. One good one is you can fill a Dixie cup 3/4 full of water and freeze it. Peel down the upper layer of the cup, that's a 1 inch showing, and then you can easily massage the affected area while holding onto the cup. Ice for about 7 to 10 minutes, 3 times a day. You can also use a package of frozen peas. Cold frozen peas are inexpensive and conform to your foot. Next is massage. Massage can soothe swollen tissue and help release your tight fascia. A good way to do this is by filling up a water bottle, putting it in the freezer. After freezing it, roll your foot on top of it. You can also use a topical medication to reduce inflammation. We recommend either Biofreeze or K2 cold therapy. Finally, you can try self-taping. I'll put a couple of links below about this. In conclusion, I hope this video has given you the tools you need to help manage your plantar fasciitis pain at home and a better understanding of how podiatrists can treat your condition in the office. If you've tried everything to calm your heel pain down and it hasn't worked, please give our office a call so we can get you back to doing what you love to do as quickly as possible.